And welcome to this webinar, which today will highlight some key developments around PPE that may contribute to local and national targets around net zero. We'll also explore how these can be implemented while adhering to or exceeding infection control requirements and optimising clinical care practices for both staff and patients. I'm Paul Anthony. I'm the conference producer here at Nolex, where we disseminate healthcare information via our training modules, our conferences, social media, and of course, as you can see, via our webinars. I'm joined today by Dr. Gareth Thompson, Sustainability Clinical and Innovation Leader, Imperial College Healthcare Trust, Steve Binney, who's the Director of Globus Group and Head of Marketing at Globus, Kieran Murphy. We'll get the webinar underway very shortly, but before we do, just a little bit of housekeeping for you. Firstly, can I ask that you don't share any of the presentation slides on social media, and please don't share any screen grabs either of the presentation slides with anybody else. There will be a PDF version of the slides available to download after the webinar's finished, and we'll email you directly when the PDF version of those slides are on the website. During the webinar, you will be able to ask questions by typing them into the chat box, which you'll find on the right-hand side of the screen, and we will try and answer all your questions during the session. But if we don't manage to do that, then our speakers will answer them by email after the webinar is finished. Also, the webinar will be recorded, and we understand that you do have jobs, and for some reason you may have to leave before the end of the webinar. So you can watch it again at your leisure from tomorrow onwards, and you can even play it to your colleagues if you wish. Okay, let's move on and let's get the webinar underway. First of all, let's bring in Kieran, Head of Marketing at Globus Group. Afternoon, Kieran.
Afternoon. Good afternoon, everyone. Really appreciate you all joining today. In terms of the session, we do want to try and get into the nuts and bolts of the net zero side fairly quickly, and pass you over to more of our star speaker, Dr. Gareth here. So in terms of, we've had a few of the introductions. I think today really we're going to be talking about, yes, we're going to be diving into net zero. It's obviously a key part of both a national and local strategy for the NHS at the moment and longer term. But obviously the way that we're going to frame this today really is about how we roll out protection and what are the barriers to the higher levels of protection that we can provide. And that really, as we're seeing it, sits in kind of two areas around cost and around that sustainability piece. So really at the end of this, we want to kind of introduce, or certainly sparking questions around that wider role and how we balance that with the net zero targets. Next slide. So just, yeah, I'll try and rattle through this. This is the short commercial bit, but a brief introduction to Globus if you don't know who we are. So we're 25 years in the making. We're a health and safety solutions company, worked right across industrial sectors as well as healthcare, and we've been manufacturing world-class solutions for a number of years now. Next slide. Obviously, then we have a number of partners through the pandemic. The healthcare side has obviously become a key part of what we have been delivering. What we didn't want to particularly do at the start of the pandemic was just engage with bringing in imported product. What we wanted to do was really start to build a much more resilient, sustainable solution, for the UK, not just for the pandemic now, but obviously for a longer term as well. And that's where the kind of made in the UK and PPE is a kind of key part of our strategy. And this we think really links into the net zero targets that we're going to be talking about a little bit more. So briefly, what have we done in terms of the pandemic? Obviously, we reacted quickly, and that gives you the outcome of what then we've kind of produced as part of that. Millions of protective masks that we've supplied into the NHS. The next stage is now for us are what's post-pandemic and what's the next pandemic, and how do we support that by balancing these other targets. So where are we now? You guys, I'm sure on the ground, I don't need to tell you to suck eggs in terms of where we're at the moment. In simple terms, we have too many patients and not enough staff. As we come into the winter season with additional aspects like flu, the NHS is already under strain. We have a workforce crisis, and we have all the the key metrics that are being banded around at the moment. Next slide. So for us then, we know that policies around vaccination and ventilation are key, but we can see that widespread application of P3 masks around NHS staff, they remain important to tackling the spread of the viruses. Now, whereas we recognise they're not a golden bullet, they can play a key role here. So we're sorting many of the NHS issues around the workforce, waiting times, require significant time and money. The use of FFP3s, which we're going to go into a bit more later on, can be implemented relatively quickly and cost effectively. And I think then we're now going to look at some of the barriers to widening that implementation. So yeah, so we can't just, the key thing, we can't just use the force in the hospital settings. If I come out with any quite bad jokes at this point through the presentation, I've obviously got to imagine that it's landing incredibly well. Everyone's sat there very engaged and laughing. I work, not just the deadpan silence that I'm getting at this point. So in my head, this is going down very well. So yeah, we've got to look, certainly as the pandemic was hitting, it was about getting supply. We restricted with the number of P3 masks we could get into the system. Now that's not the case. We've got the supply there, we've got the stockpiles there. So why isn't it now that we can apply this on a much wider basis to learn the lessons that we've kind of gone through, over the last couple of years? So what are the two fundamental things we're saying here? So we know there's a cost of purchase, that's obvious, and we're going to go into that a little bit more later. But obviously then there's the environmental cost. Healthcare practitioners as well as patients will see masks being used over and over again, and where are these going? What's the waste implication? And that causes mental health concerns, around where things are being transposed. So, we know there's a problem, and backed up by the World Health Organization, we need to look at now solutions, practical solutions, and how we solve this problem. And the important thing here to kind of emphasize and really, very much part of our approach and engaging in partnerships is this is not about greenwashing. This is not about, companies, trusts planting trees out in a faraway land to offset carbon. This is about practical solutions that we can deliver that really impact the net zero targets of only the NHS, but also of the kind of, the national economy. Less packing materials, reusable, renewable recycled material, and we'll come into obviously then that UK made, which is about shortening supply chains. So what are we doing as a business? This links in, we've got very ambitious targets with regard to net zero ourselves. And so all of these aspects really kind of fit into what we're trying to provide and deliver. We want to be a net zero business by 2027, drive and create more European products. And every product that we make after 24, we're looking to make as net zero. We're looking to build a true circular economy that operates really efficiently with 50% of our customers. And obviously, a very, very key customer to that, is the NHS and the healthcare sector. Next, please. Okay, so this kind of sets the scene before I pass over to Gareth. So within this circular economy, as I've kind of depicted here for PPE, we've really got kind of three aspects, which we're going to kind of talk about. So we've got the usage and collection side. This is where, the Imperial project will come in. But then we've got with other PPE, how do we then break that down and reutilize that fuel and oil and energy? And that's the process I'm going to go into. And then finally, the actual product itself. How do we reduce the carbon footprint of that individually? And this is where the kind of UK made and local manufacturing really comes to fruition. Okay, so I'm going to pass you over to Dr. Gareth Thompson, who's going to go into a little bit more about the Imperial repurposing project.
Brilliant, thanks, Kieran. Can we move to the next slide, please? Hi, folks, I'm Dr. Gareth Thompson. I am a doctor at Imperial College Healthcare NHS Trust. and I work in the same-day emergency care unit, but I'm also the sustainability, clinical and innovation lead. Imperial Trust is a large Northwest London trust. We've got 5 hospital sites, around 14,500 staff and over 1 million patient contacts a year. So we're a very big trust, and the environmental impact is something that we're looking at very carefully here. So I'm really delighted to say that we're working on a PPE repurposing project, which is supported by Imperial Health Charity and by Globus Group. Next slide, please. So just to give you a bit of context here, a couple of years ago, the NHS realised we really need to step up our game on sustainability. We need to be more ambitious in tackling the climate crisis and with other aspects of sustainability, for example, plastic waste. And so the NHS Greener team was formed, and the NHS Net Zero target, as I'm sure you're all aware, was announced for 2014. That was announced back in October 2020. And so as part of this renewed ambition, every trust is required to create a green plan. So we launched our green plan in May of 2021, and we formed a small sustainability team to run those sustainability initiatives and projects. And our vision is our commitment to reduce our impact on the environment, deliver sustainable healthcare, helping to secure better health for life for generations to come. Next slide, please. Now, traditionally, sustainability in the NHS kind of sat in the estates and facilities, and most of it was focused on building energy, insulation, lighting, those kinds of things. But if you look at the net zero trajectories, it's very, very clear that we need to get every aspect of the NHS involved. It's not just buildings and energy, although they have a big contribution in terms of electricity and heat and so on. It's really in everything that we do. And if you dive deep, you can see that carbon emissions and waste are a part of every single clinical process. And so in order to really get to net zero, we need to involve every single part of the healthcare system and what we do at Imperial. So with that in mind, we realized that we really need to stitch a green thread through everything that we do, and that includes all of the clinical activities in the trust. And so we created our green plan around staff, and we created it specifically to inspire, enable, and empower all of our staff to take action. And to do that, we created 12 easy to understand green plan goals. And we look to take action and build initiatives in each of these goals. But the important thing is to get staff involved and give staff the permission to step up and be able to get involved in this, and to support them where they need it. Next slide, please. So our small green team at Imperial, we're 4 people strong now, and we've been working kind of as sustainability requires across the board on lots of multiple projects and avenues. I'll just go through some of them just to give you a flavour of what we're doing. We're building a green community network, which again is to enable that thread, the green thread, to be woven through everything that we do and all the clinical pathways, processes. And it also crucially enables staff to share resources and learning from one department to another, because quite often we find that staff are running green initiatives, and they were already running green initiatives before we formed the green team and the new green plan, but they weren't talking to each other. They didn't know, our colleagues in radiology didn't know that the anaesthetists were doing something. Colleagues in imaging were doing a lot of amazing work. And so we're creating Green Community Network in order to connect those departments up, enable them to share resources and learning better. We developed an education and training offer. We're raising awareness. We built a governance and advisory structure. We're digging deeper into our carbon footprint to get a better understanding of what that looks like at a granular level. And then there's the sort of statutory, mandatory requirements of submitting our data to the Greener NHS team for our trust. And then with regards to this project, we've recently just launched a big better waste management program called Beyond Rubbish. And as part of that program, we created a waste animation. We created an easy to use waste playbook for staff to help them segregate waste better. And we created an education module that's an introduction to climate change and how to segregate waste better, but in a very short, digestible format to make it easier for staff to engage with these kinds of resources and become more aware. That's particularly relevant for this project, and I'll talk a bit more about that in a sec. But also for this project, we want to encourage innovation. So we're really keen to get sustainability innovation into Imperial Trust. How do we get those innovations in, and how do we start to experiment and make that happen and do it at an accelerated rate? So our Better Waste Management Programme and encouraging innovation are really key for this project. Next slide, please. So just in brief, I mean, the problem is very clear, right? There's been a massive increase in consumption of PPE during the pandemic and all the associated waste and carbon issues that go with that. And just as an example, at our trust alone, we used over 9.8 million Type 2R surgical face masks. So we can see that in the delivery of high quality care and keeping our patients and staff safe, which is absolutely a requirement, we're also generating an environmental impact. So this project is looking, how can we reduce that impact? What are some of the innovative things that we can do to start to rethink the way we handle PPE and what we do with it? And so for this particular project, we're looking to see, can we take the materials from PPE products, in this case face masks, and mainly polypropylene, in fact, as a material, can we take that material and reuse it instead of incinerating it as we do in the normal waste disposal process? And if we can reuse the material, maybe we can manufacture secondary hospital and community products with it, which would be a way to get that circular economy loop into the system so that we take the waste that's generated and bring it back into the NHS as a high quality product. And so what we're looking at, the main method of the repurposing project is to explore establishing a system of collection. How do we collect disposable face masks, plus or minus maybe other disposables as well, and do that in a way that's scalable and replicable, and that it collects enough volume that it becomes worthwhile to reuse those materials and create those secondary products. And the really innovative part of it is not just to take the material and reuse it, but to, as I said before, to make those secondary products. Because if we can create longer life secondary products with the short life disposable face mask material, that enables us to lock in that material for a longer period of time. And it also prevents some of the material consumption that would normally be used for those secondary products. So it's a win-win across multiple dimensions if we can pull this off. So the main aspect here is the challenge around collection. How do we do that? Next slide, please. Now, we use quality improvement methodology a lot in the healthcare system, and particularly at Imperial, where we have a dedicated improvement team. And most of that work is focused on clinical processes. So we are actually taking quality improvement methodology and we're going to use it for a sustainability project here for the repurposing of PPE and face masks. And this is really, it's really powerful because improvement methodology is all about running small scale experiments to see what works and what doesn't work. You can do something at a really small scale, test it, evaluate it, run it, find the obstacles and find a way around those obstacles. Then you have a much more an efficient and effective process to build something new and innovative, in this case, collection for face masks. And so we do something called PDSA cycles, or plan, do, study, act. And that enables us to go around those learning loops and iterate and make the process better. So the project will take place over 15 months. We started back in May in the planning phase, and we're hoping to get the first collection experiments up and running by the end of this year, beginning of next year. And after 2 or 3 quarters of running collection experiments, the idea is that we identify which collection processes work, scale those up and replicate them and get them across other departments and across the trust. And if it works really well, we could scale it across the NHS. Next slide, please. So you can see that there's 3 main kind of primary drivers, or 3 main benefits is an easier way to look at it. The first one is obviously waste reduction. And if we collect a sufficient volume of face masks, we can turn that polypropylene into new secondary products. That's obviously going to result in a waste reduction overall. And the second part is if we avoid the incineration of masks, reduce the amount of virgin material that's being used for other products, and if we use face masks and reuse face masks locally, we can eliminate some of the carbon associated with logistics and transport. The really interesting bit for me is the third box, and I didn't initially realise how important this might be, but it's very clear that amongst staff and patients and the general public, that environmental awareness is increasing. And so we're seeing a phenomenon known as eco-anxiety, where mental well-being is being affected because of the environmental harm that's being generated in the things that we do. And one of the big benefits of this project, I think, is that if staff and patients see that we're making an effort to become more sustainable, what will that do for well-being? Will it improve staff and patient well-being? I think it probably will, and we probably will see an improvement in eco-anxiety levels, which could be really interesting from a healthcare point of view, because staff and patient well-being is at the core of everything that we do. So that's going to be a really interesting benefit of the project, I think. Next slide, please. And then if we zoom out, so this is quite a relatively small scale project, but we're hoping to get it to a level where it's going to be a trust-wide impact level. But if we zoom out, we can see that this isn't just about reusing face masks and making secondary products. This is an experiment for how we can build the future circular economy for waste in the NHS. And a favourite phrase of mine is one person's waste is another person's treasure. And I think that's really key in the future, because we really need to get to a system where nearly all waste streams are reused wherever possible, and we get down to as close to zero waste as we can in the system. And so this project is part of how do we learn how to do that? How do we apply this learning to other areas of the future circular economy in the NHS? And that's where it gets really interesting for me, because if you zoom out and combine the waste element with the innovation, this can change the future of healthcare as we know it. And really, the reason I'm in this game, the reason I'm in sustainability, is because I firmly believe that this is not a trade-off. We're not trading off the environment with human health. What we need to do in the future is improve human health and deliver greener care at the same time, and protect and enable the environment and protect the natural world and the natural resources that we're all dependent on. So I see this project as learning how we can get to that double win in the future and build a circular economy that's fit for purpose. And that's all from me, and really excited to be involved in the project, and we'll do some Q&A after the presentation, but I'll hand back over to Kieran and Stephen to finish off the presentation now.
That's great. Many thanks, Gareth. Next slide, please. Next slide. Okay, so I'm certainly no chemist here. But it's very interesting in terms of what Gareth was saying there, creating kind of zero waste streams. And as I kind of talked about in that diagram, there obviously we need to look at multiple solutions here to be able to deliver that. In terms of the collection and repurposing, that's a fantastic angle to look at, but also there's going to be a finite amount of repurposing we can do. There's only so many products that you can create and deliver practically. So what else can we look at? In terms of pyrolysis, and whether you've heard of this is about converting the plastics, and as Gareth said there, we've got a prime core component being polypropylene in masks, but this goes wider than just masks. So we can break those down through pyrolysis into oil from that they originally made. How do we do that? It's about heating in the absence of oxygen, without going too technical. Stephen, I'm sure, will dive in at this point because he's been very heavily involved in the manufacturing setup process. But essentially, it's about outputting oil, which can then be used, obviously, then in terms of generating new material, new PPE. Next slide, please. Okay, so what is the process, and what's the process that we go to? So as we're talking about, the collection is going to be critical. And as I said, this is not just about collecting just masks. It's looking at a wider level of PPE, hand protection, disposable gloves, etc., etc. So once that product gets collected, it is shredded down, and you can see the pellets here on that left-hand side. This gets then grinded down, going through the pyrolysis machine, and ultimately, in the output of that is oil. Is there anything to add there, Stephen?
Yeah, I think the key that Gareth touched on about the segregation of the material is very important. The more we can separate polyolefins, so things like masks, FFP, respirators, gowns, drapes, etc., from other potential waste that could go through a process like a nitrile glove, for example, then the better the grade of oil that you get out, and the easier the process is to work. So that segregation bit is really important from the outset, which is hence why we have the collaboration with Imperial. Pyrolysis is a very well established method of dealing with plastic waste, but it only works with good output if you have good input, like most of these situations. So if we can get that right, we get oil back that can be used back into high quality respirators, for one example, or many other processes back into almost virgin grade plastic materials.
Great. Bilal, there's a very quick video on there. If you click on the right hand image, which is hyperlinked. You just open that up. It's very short, but it just shows you the process working through. And he's not pouring himself a pint there while he's having a break. It is actually that is actually the oil production. And like Stephen said, it's the separation of that PPE is a very critical part in terms of the quality of the oil that comes out through this process. Next slide, please. Right, and yeah, and this is a good way to pick up from there. So, like Stephen was saying, then how can we be more effective, and how can we be more efficient and drive the quality of that output up? We've then got we're working on knowledge transfer partnership with Heriot-Watt University up in Scotland, and they're looking from a chemical process perspective. How then can we drive the value of what comes out and the effectiveness of that process, making it more efficient? Next slide. Okay, so it talks about the collection, talks about repurposing, talks about pyrolysis. Okay, what's the other part? What's the other piece, the final piece to the pie? And that is then the product itself. What's what's the carbon footprint of the individual or the products that are being supplied? We've talked already about UK made and manufacturing locally. So what's the actual, why UK made? What's the actual comparison, and what are we saving with regard to carbon footprint? So we've done independent verification here in terms of a comparison of a UK made product like our 3530V compared to an Asian Taiwanese product like our 3030V. So we're comparing our products like for like in the benchmark between the two. So we've completed that life cycle analysis, which measured carbon footprint, and we look then in terms of the output. So next slide. So we can see, through the results that actually what we're seeing is the UK made product uses 15% lower material because of the local grid, and what we have in the UK uses 60% lower electricity in its production. There's 90% lower downstream transportation, obviously with a number of factors. And what does that deliver? That overall, that delivers a 30% lower carbon footprint for that product. So all of this then significantly impacts that overall net zero target. Next slide. Anything to add there, Steve?
Sorry, no, not that, Kieran. Thank you.
No problem. Okay, so we talked about the sustainability. What about the financial costs? We know that the P3 masks then are significantly more expensive than Type 2R, but we're seeing that by reducing hospital infections, their widespread use can be a cost-effective intervention that can significantly deliver savings rather than cost. So we need to then possibly turn the question on its head: is what is the cost of not having a policy of wider spread FFP use in hospitals? Next slide. So again, coming back to the start, what's the size of the problem in terms of days absence? We know the figures, and you guys will know this on the ground in terms of the effects of that absence on the clinical pathway, the effect of that then in terms of mistreatments, opportunities then to reduce waiting time, and ultimately coming back to Gareth's point, which is patient and staff well-being. Next slide. Okay, then, so some examples then of the actual effectiveness of that of P3 intervention. So that we know there was a study, and obviously whether you've seen this, I won't drill into too much detail. It's something you can go away and look at. In 2021, Adam Brooks through the University of Cambridge looks at the effect of P3 in a practical setting within the hospital. So within the actual COVID wards, they applied a P3 usage strategy, and then in the non-COVID wards continued to use Type 2R masks. So in a more highly infectious environment, and then you can see there on that right-hand side of the graph, after changing to the P3 mask in that more infectious environment, you actually saw then a drop in cases. So it'd be good for you to dive into that study and have a little bit more of a look about it. Next slide. And we wanted to then look at the wider impacts of the intervention, and what does that mean from a financial perspective. So we worked with York Health Economic Consortium, YHEC, and looking at the impacts of that P3 mask in a general setting, and the results from that. And again, we can supply more detail, but it looks at having hospital cases acquired the universal use of P3 actually save money by reducing both the cost and staff absence in treating patients. Again, I think coming back to the fact that this isn't a silver bullet, but actually this is a relatively straightforward solution that is available, that we can apply, that has an impact in terms of intervention. Next slide. Okay, so we've got the iceberg here, just a representation of that. So you have the visible aspects, the measurable aspects in terms of the impact on staff absence and wages of not delivering this. But then below the scenes, and we talked about again that staff well-being, the impact in terms of illnesses prevented, allowing the NHS to function more effectively and a larger value. And then all of the things then related to patients and avoiding issues on the ground, and then the costs and tax-related benefits. Next slide. So like I flagged just there, these are relatively quick to deploy, available in days. They can save hundreds of thousands of staff sick days this winter, helping to tackle these waiting lists. Can be viewed as a reasonable adjustment to protect health, safety and welfare of employees. And there are no wider barriers to use, from that. And we've already talked about then, so from a cost perspective, but also then from a sustainability perspective. As a comparison for us, and Stephen will probably have more insight to this, if you're talking in an industrial setting, and a lot of our background is there, it's very cut and dry. It's about, you would not be allowed in a particular hazardous environment without that solution. And if there was any risk to that worker, they wouldn't be allowed to step on site, and the liability is all with the employer.
I think, Kieran, I think that's very important. I think as we emerge from the sort of the pandemic scenario that we all faced, I think what has become really clear is there's a joined up solution here around how we improve safety for healthcare professionals, how we shorten the patient's journey through the process to get healthy again. And this isn't a magic bullet, as you said a few times, but it's one element which it reminds me of some of the challenges we had in industrial settings, unrelated in terms of work environment, but a similar process through the construction industry. You go back 15 years, no one wore any respirators, but you had huge issues with lung disease as a consequence of breathing cement dust over a long period of time. Different scenario, but now through education, solution provision with those kind of work environments, there's much less of that in the workplace now, and much greater understanding of the benefits. So I think what we've talked about today, and whether it's an FFP3 type 2R, whether it's recycling the product, whether it's sustainable delivery of the product, there's a need for a solution there which hangs off keeping people safe, be that the patient or the healthcare professional. And how do we do that in an effective way that enables them to have the best experience? So part of that for us is around improving the product. So it's making sure that it's easier to wear, it's simpler to use, it's less uncomfortable, all those factors which we can do as we get a greater understanding of the healthcare environment. But it's also making it carbon neutral and minimising the environmental impact on it. So it's finding out how do we get the product where it's required, how do we then process it back into the supply chain and make that circular, so that we minimise any impact on environment as a consequence of wearing these. So take away that cost issue, take away that environmental waste issue, and wrap that in a solution which isn't just around the product, it's the whole journey from production of the material through to recycling, through to the experience of the wearer and the patient.
Next slide. So yeah, just finishing off then, like I can coming back to points both from Stephen and from Gareth. You know, there's a duty of care, there's a legal duty of care to do and provide the right solutions to protect, you know, both staff and our patients. And as we learn, and as we've, you know, had significant insight now over the last couple of years, we need to apply those learnings now on a wider level, increase the standards and increase the level of safety within these environments. And then last slide, I think. And yeah, just obviously finally, without doing, I think the key thing certainly from Globus' perspective today is to spark conversation, but more than for us to look at, you know, we'd love to look and have dialogue with how we partner with these kind of solutions on the ground with Net Zero. It's not for us about supplying product direct. It's about how do we really deliver the wider solution, how we make impact, because it's about those sustainable, resilient solutions longer term. Thank you.
Excellent. So well done, guys. As you will have seen in the chat room, we have got quite a few questions. So let's try and get through them before we finish the webinar. We've got 20 minutes or so yet. Amanda Hemsley from the Leicester Partnership NHS Trust. She wants to know, as the PPE is disposed of as a clinical waste, are there specifics for sorting segregated PPE to prevent infection or contamination risks? I guess that'd be for Gareth.
Yeah, thanks, Amanda. So at the moment, as you know, we have two different types of clinical waste. We've got infectious clinical waste, which usually goes into orange bags, and non-infectious clinical waste that goes into tiger stripe bags. So for the purposes of the PPE repurposing project, we're going to focus on the non-infectious clinical waste stream for face masks. We're not going to use any of the infectious clinical waste face masks. So, for example, patients that are taken care of inside rooms that have confirmed infectious illnesses, their waste would go in, any waste involved in their care, including PPE, would go into the orange waste stream, but we're not going to go anywhere near that for the purposes of this trial. I don't know if Kieran wants to add to that in terms of the pyrolysis machines and the process there.
In terms of so I'll answer that one, Gareth. In terms of the pyrolysis process, then the waste isn't touched until it's in a secure environment. So basically, we're loading bags of waste into the machine. So there's no handling off or opening off the waste. So in theory, if we segregated infectious masks, then that could go through the process safely. The heat treatment or the heating of the product up to 600 degrees probably is where we'll end up. That will deal with any infectious issue.
And following on from that, Diane Andrew wants to know, will this include the polymer aprons used in the NHS within the pyrolysis machine?
Again, yeah, it works best with at the moment with polyolefins, but the work we are doing with Heriot-Watt is to look at, can we find some kind of new catalyst which enables us to take multiple types of plastic waste and feed that through. You can refine it through the pyrolysis process with different materials, with different temperatures to change the output oil that we get back. Basically, from a commercial point of view, the higher grade of oil we get back, the more valuable it is back into the plastic market. But you can use pyrolysis as a process for any plastic waste generally. The more segregated it is, then the better the output you get. So yes, it can do aprons as well.
Excellent. Joanne Smith wants to know, as this is a trial, are there any plans to roll this out with support from waste companies to uplift PPE segregation? All the microphones are off.
I can jump in there. So at the moment, we're going to focus on the collection process, but we will be talking to our colleagues in the waste department, and they in turn have contacts with the main waste contractor. And so if the collection experiments prove to be viable and feasible and we're able to scale them up, at that point, we'll need to also involve the waste disposal companies to see how that exactly would work in practice. So it's part of the roadmap, but it comes a bit further down the line.
And Gail Lusardi from Public Health Wales, how viable and cost effective will this be as we move out of pandemic and the use goes down significantly, or will it go down significantly? Anybody?
Sorry, I lost that for a second there. I'm not sure if it was my signal went.
I'll read the question again. How viable and cost effective will it be as we move out of pandemic and the use goes down significantly?
Okay, I think we're still seeing, well, effectively out of pandemic, I guess at the moment, we're still seeing significant usage on type 2R across the country in healthcare settings and also on FFP3s, clearly not levels that they were before. But if you look at, as we are extending this into other areas, so gowns, drapes, that kind of polyolefin-based material can be run through pyrolysis. If we can also develop the technology to allow us to handle nitrile and therefore nitrile disposable gloves, there's a very large waste created of those kind of products, which we could then deal with in this way. So I think broadly speaking, there's big opportunity across healthcare settings for this kind of solution. It may not stop there. Maybe other things that we can add into that process as well.
And Gail also wants to know, are you able to use this method to make FRSM? Currently, FFP3 is not recommended for use within guidance at all. Oh, sorry, for all.
Help me out with the lingo. What's FRSM?
I think now you've got me as well. Gail will probably tell us. But let's move on to another question until Gail comes back to us. Are you suggesting that all patient-facing staff wear an FFP3 mask when at work, irrespective of whether they're dealing directly with patients or who are COVID positive, or whether they're involved in AGPS or AGPs?
Like I think that that's one which is not something we would have a strong opinion on. I think what we would say is it's important to understand the benefits and the challenges of using an FFP3. The more locations that you use an FFP3 in, providing it fits properly and is effective, then you minimise the risk of any harm or any infection to the wearer. But I guess, like any environment, it comes down to the application of that and the practicality of it. So, I would argue very strongly it doesn't make sense for every single patient contact to have an FFP3 on there. However, we have, certainly some of the health boards and trusts I've worked with, we've had COVID wards where staff members are wearing type 2Rs, which will offer them no protection from anything in the environment in that ward. So I think, again, there's probably broader understanding needed of the benefits of wearing this kind of product and where that can practically be used. And I guess if we look back 3 years or to 2019, the volume of FFP3 used in healthcare settings was really minimal compared to the employee base and the amount of patient contacts. So I think during COVID and during the pandemic, people realised the benefit that could be ascertained by wearing FFP3. So I think there's a broader conversation there and some practical thinking around where best to utilise that kind of product. But certainly if you're wearing one, you're going to be less vulnerable to infection from any kind of virus.
John Thompson from the Yorkshire Ambulance Service. Who's the organisation that you mentioned? Second question, how hard has it been to segregate PPE streams?
Can you repeat that, Paul? Sorry, you broke up.
Yeah, sorry. So John Thompson from the Yorkshire Ambulance Service. Who is the Yorkshire organisation that you mentioned, and how hard has it been to segregate PPE streams?
Was that you, Gareth?
Well, it wasn't me. No, I wasn't talking about any Yorkshire organisations, as far as I'm aware.
I must admit, I didn't hear anything to do with the Yorkshire organisations. But the other question, probably for Gareth, how hard has it been to segregate PPE streams?
Yeah, so I mean, just to segregate all the different waste streams that we have in the NHS at the moment, it's obviously quite complicated, and clinical staff are really busy. And so a lot of our work at Imperial has looked at how do we raise awareness and educate staff, but do it in a way that makes it easier for them to segregate waste into the correct waste streams. Because we know that staff are time pressured and they don't have the bandwidth to focus a lot on the complexities of waste segregation. So it is a challenge, and it requires a bit of some common sense thinking, but some clever sort of behavioural insights on, there's the easy stuff like if you position a bin in the right place, people are much more likely to put the waste where it needs to go. And so, yeah, there's a lot of work to do there. And if we're going to segregate PPE as well, then we need to figure out how to do that and nudge behaviour and do it and make it, the key thing is to make it easy and accessible for staff to do that without adding more burden to busy clinical staff and, making their job more difficult. We should be making it easier.
Yeah. Just to chip in on that, I think they said there's a whole behaviour change piece, and this is, you could compare it to the whole experience from staff as they navigate through those environments, and making that process as clear but also identifiable. Currently as you walk through the entrance to many hospitals, there's a real mixed message of different colours that are indicating warning, indicating where you put your bins, where you do collection. And this is now the whole part of the process, coming back to look at the work that was done, you know, commercially with supermarkets as you walk through, looking at where people's eyesight is heading, what are the first things they see, what are the first things they grab. This is the kind of behaviour process that we need to look at.
You mentioned a little bit earlier on about repurposing. What kind of secondary products do you think would work best for repurposing masks into?
I think it depends how you do this. One way of reusing the material is basically to melt it back into polypropylene and then grind it up and use it. That gives you a sort of secondary grade recycled plastic. So that type of thing, in theory, it could go in. Well, a good example: patio furniture, the plastic chairs and tables we all have seen kicking about. But there's a limit to how many patio chairs you need. In a healthcare setting, it could go back into things like perhaps plastic bedpans, etc. That type of thing. There'll be many other environments. The pyrolysis solution goes one step further. It breaks the material back down to the original oil state. So in that method, it allows it to go back in to be mixed with raw crude oil before it's cracked, before it's processed. So it takes it right back to the refinery, and you can then add that back in to the starting process to then create the raw material. So we make respirators and type 2R masks from polypropylene. That polypropylene comes from a refinery where they crack oil, hydrocrack oil, and turn it into different types of plastic material with different additives to it. We're taking it right back to that stage where we'd feed the oil back in. So on that basis, it can go really into any kind of plastic component or material or product.
I've got another question here. How do busy hospital staff currently cope with waste segregation, and will recycling masks make this even more difficult?
I think I think we already kind of covered that in that there's a bit of behavioural insights there and making it easier for staff. I don't think there's anything more we can really add there. I mean, sure, it can add a little bit more complexity to waste segregation, but if you do it in a smart way, and then it can be done quite easily, I think. Staff are actually really keen on doing more at work because they're doing more at home for the environment. People are making more of an effort to segregate their home waste streams. And so I think there is an appetite among staff to learn how to do it better.
Another question here then. Sorry, Steve, are you going to jump in then?
No, I was going to really back what Gareth said there. I think that's key, and I think how we make that simple for busy people is key. And I think a big part of the work with Gareth and his team at Imperial is figuring out how we make that happen. Behavioural change is be something we're all going to have to go through when it comes to handling a waste, domestic or at work, whichever that looks like. I think that's going to be made easier if it's simple. So I think that's a key part of the project, and it's a really important solution that we find.
So aside from the carbon footprint, why is UK made products important? What is the importance of that?
To me, I think it's what we're talking about today. We're talking about providing PPE which keeps people safe, which we've always done. But we're talking about how can we come up with an effective solution that goes beyond that for the healthcare sector in the UK and beyond, hopefully. So that solution provision approach is what we do. The manufacturing that in the UK allows us to focus on that. Yeah, you can go Southeast Asia somewhere and buy some Type 2Rs or FFP3s. They'll take your dollar and they'll give you a box of masks. We're doing a bit more than that. So as I mentioned earlier, where we're focused is how do we improve the experience for everyone? So how do we improve the product so that it is more comfortable, uses less plastic, uses recycled plastic or non-oil-based materials as well, is something we're working on. If we make it in the UK, the other massive benefits there is certainly we shorten the supply chain. But also we keep some of that taxpayer money back in the UK as well. If you go and buy a mask for £1, $1 or £1 in China, you get a mask and they get your £1. If we do that in the UK, then we pay salaries, we contribute to community benefits, we create employment and wealth in local communities. So that's pretty much circular. We refer to it, you get a bit, or the taxpayer gets a bit of cash back. I think what excites me on that side of things, commercial aspect, is we learned during COVID that actually we can compete both in terms of cost and value and also quality manufacturing UK against imported product. So I think that gives us a real win-win major customers like the NHS.
FRSM, by the way, fluid resistant surgical mask.
Ah, cool.
There we go.
Should we have known that? Yeah.
And yeah, and thanks
to
everybody that's.
What was the question? What was the question then?
I'm going all the way back up to it now. Let me find it. Another question. I'll find that one. But in the meantime, trusts, hospitals, etc., are under pressure to deliver. So why should they prioritise sustainability?
One for me, I think.
Yeah.
Well, I mean, as a clinician myself, I know that we're all under pressure, and so that there is a tendency for organisations to say, oh, you know, we'll deal with it later when we don't have winter pressure, we don't have COVID pressure, we don't have the next pressure. But I mean, the reality is if we keep kicking the sustainability can down the road, it becomes more and more difficult to deal with because the environmental degradation mounts and becomes accelerated. And it becomes, you know, in particular when you're talking about climate change, the quicker we act on that, the cheaper it's going to be, actually. And the same will apply for trust. So even if it takes a bit of investment up front, the long-term benefit is, I mean, it's incalculable, it's priceless. The preservation of the natural world is essential for human health. And I think we forget that, and we forget the timescales that these things are happening at. It's not in the distant future, it's happening right now. And we need to get on top of it, and that's going to be a priority for human health. I think the Lancet Medical Journal said that climate change was the biggest health threat in the 21st century. So that gives you an idea of the scope of the impact. So it's very important, and we can't keep on kicking it down the road. We're going to have to just get on and do it, I think. But do it in a smart way and do it in a way that makes it easier again.
Excellent. And I've found the question, Steve. Are you able to use this method to make FRSM? Currently, FFP3 is not recommended for use within guidance for all.
Yeah, we can. And FFP3 is fluid resistant. There's a medical standard EM 114683, which certainly other P3s are approved to, which gives them a fluid resistant test. So yeah, there should be no reason why FFP3 is used in that way.
Excellent. So we've got 2 minutes. If you guys would like to summarise what we've spoken about over the last hour, let's start with Gareth.
Yeah, so I'll make it brief. Just for anyone that missed the details, we're running a PPE repurposing project in partnership with Imperial Health Charity and Globus here to see if we can collect PPE, and in this instance, face masks and the polypropylene in those masks, and reuse the material for secondary products, hopefully secondary hospital products. And we can start to build some learning on how we can embed a circular economy into the future NHS. So it's really exciting, and we're doing our bit for human health and sustainability, greener care and better human health.
I don't think I can summarise much better than Gareth just did there. But yeah, I think to reinforce, it's about taking action now. This is commercially what we're doing, and it needs to kind of link in on that wider level. It's got to be about that circular solution. It can't be token gestures. And I think this is for us the partnership of really trying to deliver that with these multiple solutions.
I think from me, I think I'm very aware, it's been very visible how much single-use plastic products we've produced over the last 3 years, which have been, required and necessary. But I want to be leading a business that is part of the solution here, not part of the problem. So finding ways that we can do that in a much more sustainable way that minimises or stops any impact on the planet is what we're looking to do. And there's lots of ways we can do this. This is a great example. The way to do that will come from collaboration with key stakeholders. Imperial, what we're doing with Heriot Watt Uni, etc. They're all critical to this. So there's a whole lot of work going on to find creative and innovative solutions to solve these problems, which, hopefully if there is a next COVID, next pandemic, then we're not in a situation where we're throwing lots and lots of plastic away, that we're doing something with it to reuse it and recycle it.
That's excellent. So I've got to say we're running out of time. So my thanks to Gareth, to Steve, to Kieran. Excellent presentations. Thanks very much. Hopefully you guys have taken something from the webinar. Any questions that we haven't answered, and there are quite a few still in the chat box that we've not had time to get to, we'll forward those to the speakers and we'll endeavour to answer them by email. If you'd like to watch the webinar again at your leisure, then it will be available on the Nolex website from tomorrow morning. Just go to www.nolex.co.uk and click on the webinar banner. But for now, that's it. Thanks for joining us, and hopefully we'll see you all again soon. Bye.